of the general populace, but also serves as a training center for medical students at the State University and beyond. I'm glad to report that on account of the measures we have taken to rebuild trust and improve staff welfare, public confidence in the health sector is returning. We shall continue to make all the necessary investments in human capital and equipment to ultimately achieve our governance agenda for this sector. In pursuit of our broad objectives for the healthcare delivery system, we have gathered this afternoon to flag off a project that will see the state government renovate and provide operational infrastructure to 200 primary healthcare facilities across the 184 wards in the state over the next 100 days. This initiative is set up to improve the access to quality healthcare, especially in the rural communities, reduce exposure to quacks and fake drugs, and effectively improve good health and longevity for the general populace. This initiative has been tagged Project Ekweme by our team of the State Ministry of Health because it practically speaks to our commitment to fulfilling the key promises we made to change the healthcare delivery landscape in the state for the better. The primary healthcare facilities we intend to set up in all parts of the state shall have its independent power supply from renewable energy sources, efficient water supply system, and other support infrastructure to improve the operational environment, preserve drug supplies and medical consumables, and ultimately save costs for the government and its partners. We are committed to the use of high quality and durable materials for every step of the construction process, because this is our own. We shall not tolerate any form of mediocrity, as every contractor will be required to provide post-delivery infrastructure maintenance services at the facilities for at least 5 years. Community leaders and other stakeholder groups are encouraged to be part of the project monitoring and evaluation efforts. All acts of sabotage or attempt to steal from the facilities before, during, and after construction activities shall attract very severe consequences by the government with the cooperation of our people. The security agencies have also been mandated to keep their eyes on what goes on across the 200 project sites and use every legitimate tool available to them to frustrate any effort to scuttle our program. We have carefully incorporated local contractors to drive this initiative in various communities, and as such, we know who to hold accountable when project specifications are not met or when willful sabotage is suspected. This project is set up to benefit present and future generations of Abia by improving our maternal care and childbirth management records, prevention and control of outbreak of diseases, and offer first-level care to anyone who needs medical assistance on a round-the-clock basis. Let me especially thank the Honorable Commissioner for Health, Professor Enoch Ubonaya Uche, and every other team member working in the health sector for their commitment to the transformation of the public healthcare delivery ecosystem. The state is blessed to have an excellent team of professionals working with us to improve the entire spectrum of the public health ecosystem. We shall continue to give them all the necessary support to actualize our shared vision and effectively create a legacy of service excellence that shall become a model for the rest of the region. May I also appreciate our local and international partners for their commitment to affordable and effective health care for the average individual across the state. Several religious, social, and philanthropic organizations, multilateral donors, and development partners have been consistent in their support through the donation of materials, funding, and technical assistance. We shall continue to work closely with these groups because quality health for all is a shared global vision that requires effective collaboration across multiple frontiers. The state remains open to welcoming new partners as we seek to combat the multiple health threats facing our various demographics. In addition to remodeling 200 different healthcare facilities in different communities, we shall also accelerate multiple capacity development programs for the body of healthcare professionals to bring them up to speed with evolving trends and new ideas in the operational areas. It is common knowledge that the healthcare industry has been hit by an acute personnel shortage in the last few years owing to the Jaffa syndrome. But we shall not stop there, because that is the nature of labor in today's global economy. What we shall do instead is to commit greater resources to training of new professionals, as we have rightly done in the 2025 Appropriation Act, where the princely sum of 8.6 billion at the NIEM Act for the construction of the permanent site of the Abia State College of Health Science and Management Technology, Abia. We have also made a 5 billion provision for construction projects at the new College of Nursing at Umunato General Hospital, very close here. While another 3 billion will go into the construction of classroom blocks at the School of Nursing and Midwifery, Amacha. Clearly, our strategic roadmap for the health sector is on course, and by the end of the third quarter of the year, extensive improvements must have been recorded as new infrastructure projects, including these primary healthcare facilities, are completed and delivered for use by the general public. Let me, as always, invite you to continue to cooperate with us as patriotic citizens as we prioritize the well-being of our people. Pay your taxes as and when due, protect public infrastructure in your communities, and do not hesitate to report to the security agencies any person or group whose activities could pose a threat to the peace and security of the state. The government remains committed in its resolve to serve and work for the collective good of all residents of the state, and expects the full cooperation and prayers of every well-meaning Abia. Let me use this opportunity to thank the community and the President General, and of course the Uzakoli people for the special gifts of yam and all the other things that go with it. And I was shocked to see that the kind of yams that came out here were actually from Uzakoli. I've taken note of the request of the President General. I'm going to engage with the security forces to ensure that the story of Fulani herdsmen will be a thing of the past. It is important to understand that this government does not tolerate destruction of any kind. So I'm hearing for the first time that we're going to deal with it. In like manner, we will also, the Commissioner of Works, I believe, is somewhere here. If he's not here, the Chief of Staff is here. So they are going to, as quickly as tomorrow, have a look at the road that you mentioned, so you can see what we can do. So once again, I would like to also thank the lady who spoke so passionately about her experience here, and thank God that she was patient, because if she wasn't patient, she wouldn't see today. So we thank you, and we continue to pray that people like you should populate our state. And that note, distinguished ladies and gentlemen, let me thank you once again for being part and parcel of this flag off. I wish you journey mercies as you go back, and I also wish all of you a happy New Year. God bless you.
Thank you so much. alongside Honorable Commissioner for Health and lead consultant of the project in Kwemi, with other dignitaries here present. We'll be moving in now for the flag off and inspection of the facilities we have here. Thank you. All right, that's the equipment governor of Abia State, our talk and do governor, the people's governor of our time.
I don't lie for me, girl. I don't lie for 301. Also, oh, but it's not part of the what the man when you want to do. Yes, I'm doing that, sir. Yeah. For my life. I don't life. Of course, I don't life. Yeah. So, my boss was also. Who do you know why I'm getting my material? Yeah. What's the mic? First of February. Let me shut down first. I won't push it here. Let me all the shine down. Now that make all the shine. Okay. Sure. Okay. No, yeah. I'm good, Jim. How far? My brother, business here, all right, all right, made a move. So, go your right, can get yourself. Okay, that's issue for you. This is my brother. No, I'm gonna go. Oh, we can you walk? Come on, go behind. Come on, go behind.
We're done with the inspection of the facilities. Ladies and gentlemen, immediately His Excellency the Governor steps out, we'll have the national anthem, and then there will be a photo session with the heads of the government health institutions right here. Thank you so much, dear Governor. And of course, that brings this event to a close. We appreciate you once more for this honor today. Please, may we all rise for the national anthem. Thank you very much. Thank you, His Excellency. Of course,
let's work together. I don't want to promote this man. I
And this is our man.